Hello, my name is Chelsea Fitzgerald. I'm a program manager with James Care for Life. Welcome to our caregiver program, Organizational Tips for Caregivers. Dr. Elizabeth Monks will be presenting. Liz Monks is relatively new to Ohio and to The Ohio State University, moving to Columbus 7 months ago to pursue her passion of working with cancer patients, survivors, and families with the James Cancer Center. Liz is currently an assistant professor with the Department of Psychiatry and Behavioral Health and a clinical psychologist with the James Psychosocial Oncology Department. She received her doctoral degree in clinical psychology from St. Louis University and completed her internship at the University of Wisconsin. She completed her postdoctoral fellowship in psycho-oncology at Washington University School of Medicine's Siteman Cancer Center in St. Louis in 2014. Liz is currently involved in research, teaching, and supervising a health psychology rotation in oncology here at OSU. In addition to working as a clinician full-time, seeing cancer patients, their families, and caregivers to address emotional and psychological needs as they relate to the stressor of coping and dealing with a cancer diagnosis. Although she is a native Wisconsinite and an avid Badger fan, she is slowly but surely becoming a Buckeye fan and taking solace in the fact that she's not from Michigan. Welcome.
Good evening. I'm going to be talking tonight about organizational tips for caregivers and mixing in some ideas for just resources that might be helpful in helping caregivers get organized as well, because we know organization can be a challenge for everyone, and especially for caregivers when they're caring for somebody with cancer and life in general. So the objectives and the highlights of the things I'm going to be covering and talking about include discussing why is it important to organize, and then these are some of the areas that I'm going to focus on. So financial organization, how to get a little bit more organized with appointments, medical information and medication, which can become very overwhelming very quickly, how to get organized with that type of information, what to do with all the questions that may come up from time to time over the course of caring for somebody with cancer, what to do in an emergency, and then how to organize your thoughts or your worries, which can become chaotic sometimes as well. So it's important to remember that there are things to do to help kind of get our minds organized, as well as our, kind of the more practical everyday types of things. So organization is very important. So we know that it decreases anxiety if you can take more of a solution-focused approach, which often includes getting organized in some way. We know that people who are organized experience less stress in general, just because it's, when things are in their place and things are easy to find and easily accessible, it's one less thing to stress about or worry about. It helps with time management. So if you think about if you need to find a phone number and it's in a heap of papers on a desk, it's going to take you that much more time to find it versus, 20 seconds to go to the refrigerator where all the phone numbers are listed. So organization helps with time management, which is important when time is of the essence and you maybe don't have a ton of time to spend looking for things or tracking things down. When things are overwhelming and chaotic, which, cancer can create a lot of stress in life in general, I feel like one way that you can gain control in a situation where there's a lot of non-control or a lot of question marks or a lot of things that feel out of control, getting organized is one thing that you can do to help you feel like you have some control in a situation. So I also wanted to talk a little bit about some of the research on organized people. A lot of the research on organized folks is on women. I'm not sure if that's just because women tend to be the caregivers or tend to be the ones who are organizing. I'm not sure exactly why that is the case, but a lot of the research is focused on women. And so in a study done in 2009, women who reported that they had a lot of clutter or disarray in their lives actually reported more depression, increased fatigue, and higher levels of cortisol, which is associated with higher levels of stress. There's also another part of that same study where they looked at the home specifically, and higher stress homes that were highly disorganized. They reported, the women in higher stress homes with disorganization, women reported increased depression just over the course of a day. So they broke it down to what does somebody's mood look like in a day when home life is pretty disorganized. And women with more restorative, less stress, more organized home had decreased depressed mood over the day. There's also an interesting study done in 2013 where a lot of people, I think it was about 150 people, were brought into a lab space, and they were either put into a workspace that was very neat or a workspace that was extremely disorganized. And they were asked to do a task or work for 10 minutes in either the neat space or the disorganized space. And the people who worked in the neat space for 10 minutes were twice as likely, they were asked then to go out and get a snack at a little convenient area where snacks and things were sold. And those folks who worked in a neat space for 10 minutes were twice as likely to choose an apple over chocolate than those who worked in a messy area. They also found, so it's interesting that it seems people maybe make better decisions or healthier decisions, at least when they have neat, organized space. But I also thought this study was interesting because it found some pros to being disorganized. So I guess in some ways maybe disorganization can't always get 100% a bad rap. So the folks who worked in the more disorganized space were found to be more creative, and when they were asked to do a task, they came up with new and different ideas and were willing to just be more flexible. So in some ways maybe being disorganized may force people to come up with a new way of doing things, which can be a good thing as well. And the last study from 2011 looks specifically more at our neurological functioning, how our brains function in clutter. So messy spaces and areas actually are found to overload what we see or our visual cortex, which then interferes with our brain's ability to process information. So if I am looking at a board of information that I need to take in or understand, maybe somebody's written some notes to me about what I need to do for the day. If that's organized, I can process that information better versus if I'm looking at a board and it's got all kinds of scribbles and other things written on it, that actually creates interference and kind of creates issues for my visual cortex when I'm taking in visually, which can have an impact, a negative impact on the brain's ability to process information. So organized people tend to be, less depressed, less fatigued, less stressed in general, processing information better, potentially making better decisions. But disorganized people or people who work in disorganized spaces sometimes have some pros too, and that they can be more creative or willing to try new things with flexibility. So the first area of organization that I wanted to talk a little bit about tonight is getting financially organized. I feel like this can be really overwhelming for caregivers dealing with bills and finances. And this slide is just an overview of some places where you can get some assistance, different organizations that offer financial help to specifically to cancer patients, families, caregivers. So the Cancer Financial Assistance Coalition, or CFAC, is a national organization that provides financial help. They also have this really great, if you get online, you can search a huge database. It's super helpful. You can put in your area, and they will bring up financial resources that are applicable or close to you, close to home, where you can find some information on financial assistance. There is the Cancer Cares Financial Assistance Program, the Health Well Foundation, which is a nonprofit organization that helps with insured patients. So this is kind of an interesting one. So a lot of help is for folks who maybe aren't insured, or this specifically helps people who do have insurance with a chronic life-altering disease, specifically with medication. So medication can get very expensive very quickly. So the Health Well Foundation specifically is a nonprofit that helps with medication finances. Leukemia and Lymphoma Society is one that's pretty well known by folks. They provide some limited financial assistance to anybody with a blood or bone cancer, so the leukemias, lymphomas, myelomas. And then the National Foundation for Transplants, I have heard of that foundation before, but I thought it was for solid organ transplants only, like kidney, liver, heart, lung. But when I did a little bit more digging, that also includes bone marrow and stem cell transplants as well. So it's another option for assistance. They help actually with people raising money and fundraising specifically for those who are going through transplants. So just a few organizations that are out there. As far as getting your own financial assistance from other places or getting organized, GoFundMe is one that I've seen a lot lately. People are utilizing the website GoFundMe to raise money for caregiver, for people that they're caring for friends, for family. You could start your own if you wanted, but typically I've seen caregivers doing this, or friends or family members starting a fundraising website for somebody who's struggling with medical bills or illness or loss or things like that. And it kind of runs the gamut. I've seen GoFundMe pages for cancer patients, for somebody who lost their home in a natural disaster. It kind of runs the gamut of all kinds of things. But when I went on the website, it's really, really user-friendly. They have a little tutorial video. You upload a picture of the person that you're funding for, write a little blurb about their story, and then you send the link out to anybody who might be interested in donating, and you can set a goal, and it'll kind of keep track of money as it comes in, and then it's easily transferred to the person who you're raising money for to a bank account that you can link to it. So it's pretty user-friendly and easy to use, and a great way to get people, even if people want to donate like $5 or $50 or whatever the case may be, you can donate any amount. So that's a good one and a good way to help get organized if you're trying to help somebody. The American Cancer Society has some good resources on their website as well. They have a whole support tab when you go on their website, and also some personal fundraising options similar to the GoFundMe. You can do something similar through the American Cancer Society as well. And the Salvation Army, Catholic Social Services, United Way, local churches, these are just other places that people have found help with finances when other things have fallen through. So I think sometimes people forget that those more local things are options as well. And I wanted to also hit on specifically at the James, and I know financial counselors exist here at the James and other cancer centers as well. And sometimes I run across caregivers and patients who don't even know that the financial counselors exist. So they do exist, they are available. This kind of runs through what their role is to help patients and caregivers understanding insurance benefits, co-pays, deductibles, out-of-pocket and covered services, which can get overwhelming quickly. So it can be nice to have a financial counselor kind of sit down and walk through all this information with you. They also can help you learn about assistance programs for uninsured or underinsured, connect you with billing department, help you figure out if you're Medicaid eligible, connect you with a social worker, a medication assistant representative if you need help with paying for things. And then I have the phone number there if you're interested. You could ask anybody on your medical team for that information as well, but that is the number if you would like to talk to a financial counselor about any of these things: payment options, assistant programs, and other resources. And then just a few tips about financial organization. And I think these are things that people probably typically know, and they know I probably should be doing this, but don't do it. Opening all bills is important. I've heard that it can get pretty easy for bills to just kind of stack up, and then it gets so overwhelming that it's just easier to avoid it altogether. But making sure you open everything, look at everything, throw away what you don't need, have a central place for important bills. Going paperless is more an option these days, where you can have everything, do your banking online, pay your bills online. If that's possible, it helps at least decrease with some of the clutter that can accumulate with paper bills. It's important to try to review the budget monthly. I know that's a tricky one. My husband often tells me, like, we need to sit down and review our budget. And I say, what budget? Like, what's the point of reviewing the budget if you don't have anything? But that being said, it's still important to at least know where things are a struggle or get a little organized. Maybe you might see a place where you could save a little or pinch a little or let something go or add something in. So even if it feels like there's no money to budget, it's still important to try to look at your finances monthly is kind of the recommendation. Using a filing cabinet, computer filing if you'd rather do everything on a computer, or those big accordion files can be helpful for just like stuffing things in and getting some kind of organizational system started. And then also trying to match a provider statement with insurance payment statements or your explanation of benefits forms. I feel like all this stuff, bills can come in, insurance paperwork comes in, all this stuff that actually you probably need it to be together don't always come together. So trying to match things so that you have it together and you're not searching all over the place for something else. So shifting a little bit to keeping track of appointments, which can be grueling and a lot to manage, especially if caregivers who often, I think, take the role of making sure appointments are made and rescheduling and doing these things. Having a calendar is probably the most important way to get organized with appointments, and that can be any kind of calendar, a written calendar that you carry in your pocket, a calendar on your phone, a calendar on your refrigerator, next to your bed, whatever works for you, having some way to keep track of the dates and the times. OSU MyChart is a great way to also keep track of appointments. OSU MyChart is basically being able to access your chart, your appointment times, all online through OSU. And it's pretty easy to sign up. You have to get a sign-in code basically when you come in. Anytime you come in for any kind of appointment to the James, to OSU, you can ask the scheduler, the person that you check in with, just say, hey, I want to sign up for OSU MyChart, and they'll give you a little code that you can use to sign up for it online. And then it's a pretty easy process. It's like your name, date of birth. I think you need your medical record number, and then this code, and then you can set up your access to OSU MyChart where you can see all of your appointments, the dates, what times, who they're with. You can use the MyChart to see, test results, to communicate with your providers if you'd like to use that as an option as well. Appointments, another option that you can utilize is asking your provider to print out an after visit summary. So after visit summaries often include when your next follow-up appointment is. So say you forget to write it down, or you don't have it, you don't have a pen with you, or you don't have your calendar with you, they can give you a printout so you can take it home and add it to your calendar. And then there's also this Cancer Guide app, which is an app that has been developed by the Livestrong program. And there's a little quick video that I want to show that gives a little bit of a preview of what this Cancer Guide app looks like and how it can be utilized.
I'm Dr. Brandon Hayes-Latin, Livestrong's Senior Medical Advisor. Welcome to the Livestrong Cancer Guide and Tracker. At Livestrong, we believe you should have the information and tools you need to make well-informed decisions throughout your cancer journey. That's why we're introducing the Livestrong Cancer Guide and Tracker iPad app, which lets you store and access information relevant to your treatment and survivorship electronically. The Cancer Guide will help you know what to expect, learn what questions to ask, and connect to resources. The Tracker helps you organize your appointments, treatment information, and medications, as well as provides a daily journal space and a symptom tracker. We hope you'll share the information from these tools with your loved ones and healthcare providers to get the support you need throughout your cancer experience. We created this app as our first step in helping patients store, access, and share their cancer data. Livestrong will continue to add and enhance functionality to the app to help improve the quality of care, engage patients in clinical decisions, and facilitate research for improved health outcomes. Thanks, and live strong.
Okay, so I think that gives a little bit of a introduction to what that app looks like. So you could use it on your phone or your iPad. What I am accustomed to is seeing that Livestrong Guide app as not an app, but an actual like binder full of information. I have some in my office that I've given to patients before, so that also still exists. You don't have to use the app version of it. They do still do like a paper version of the same thing where you can track, you can journal, you can keep your appointments, you can write down questions. There's a resource guide in it. So if an app seems too overwhelming, you can still order an option to have a physical app that's paper, or not an app, a physical cancer guide that you can hold that's tangible, if that fits your needs better. So as far as organizing medical information and medication, there's lots of different ways to do this. And again, lots of apps, lots of kits that are available to use. It seems like there are endless options for, different things you can use to get organized. Keeping a journal is a great way to just keep track of medical information, side effects. I know sometimes it can be really hard when you go into a doctor's appointment and they ask, how are you doing? Well, my goodness, how am I doing? I've been nauseous lately. Well, how long has that been going on? And does it last all day and multiple times a day? And when you take your medication, does it help? Or it can be very overwhelming to answer lots of questions about how you're feeling and how things are going. So keeping a journal can be really helpful, just a day-to-day, what your thoughts are, or even just how you felt that day, what symptoms were happening, what made things better. Checking in and keeping a journal can be helpful for documentation purposes to help trigger your memory and convey important information to your medical team. OSU MyChart is another great way to access your own medical information. So in addition to keeping track of appointments, the MyChart option is great for keeping track of medical info as well. And then, of course, there's another app, the CancerNet mobile app. And this one, I think, from what I've seen how it works, and it's great specifically for the medication standpoint. So it lets you save information about all of your prescriptions, and then it has these options for you to take a photo of the labels of your medication. So it's almost like you're carrying around all your medications without actually having to carry all the bottles. And then it also has a symptom tracker and a bunch of information about side effects and other medication information. And then there's also the American Cancer Society Personal Health Manager Kit. This is, I guess, somewhat similar to the Livestrong Cancer Guide as well, but same type of thing where it's not an app, it's an actual physical paper kit that helps with organizing appointments, medications, insurance, bills. You can personalize it, and you can call or get online to order one of those. And again, that's not an app, but something that is tangible and paper version. And then, of course, pill boxes are a great way to organize medication. There are, from what I've seen, a million different types of pill boxes. It's actually super overwhelming. 7-day, 14-day, Monday through Friday, AM, PM only. There are lots of options. So you should be able to find something that fits your needs. And you can often you can order pill boxes. You could ask your pharmacist about pill boxes. The James has clinical pharmacists you can inquire about getting a pill box from as well, or different ways to organize. Sometimes people use medication calendars if they're not fans of pill boxes, or using a color coding system. So using a Sharpie or something to color the tops for AM, PM, or whatever kind of organizational system makes sense for you is the one to use. If pill boxes don't work for you, and I have asked patients before, how do you organize your pills, or how do you stay medication organized, and they point to their caregiver and say, he or she does it. So whatever works for you to organize is the way that you should do it. There's no right way. There's lots of right ways. And questions. So I think both patients and caregivers often have questions that come up all the time about what's going on with their loved one's medical care or finances. I mean, questions can arise about just about anything. So keeping a running list is important, and having something to write it down all the time. So carrying a little notebook with you. People are using their phones a lot to jot down questions. Keeping a notepad by the phone or by the bedside so that you can keep a running list of questions and remember them, because things can get pretty overwhelming and chaotic quickly. So if you don't write it down, you might forget or lose track of it. If you have questions, you can also, I think it's important to remember that even if you don't have, your loved one doesn't have an appointment with their doctor for several weeks, you can always call and schedule a consultation if you'd like to see your doctor sooner than that, to see if you could be fit in, or if you could talk to maybe the nurse practitioner or somebody. So I always advocate that if you do have questions, you don't necessarily have to wait until your next appointment. You can get in touch with your medical team and say, hey, I have some questions. How can I get these answered? OSU My Chart's popping up here again because there's a great way to send messages to your medical team via My Chart. So it's kind of like an email system, but it becomes part of your medical record. So all of that information is tracked if you send a message to one of your providers if you have a question. So it's a quick and easy way to send something that's maybe not so emergent. It's not a great way if you're having an emergency. I would say not to use OSU My Chart for that, but for more general questions that don't need an immediate response, that's a good avenue. So the National Comprehensive Cancer Society has a Pocket Cancer Care Guide app. The National Coalition for Cancer Survivorship designed this, where the app has like a list of questions that other cancer patients or caregivers have asked to maybe help you generate ideas for different questions or how to ask. You can build your list to help you guide a conversation when you come in for an appointment. I like that it has a recording aspect of it, so you can record what your physician or your nurse or your oncologist has to say back to you, because you may not catch it all when it's coming at you, so having a recording of it can actually be really helpful. The side note on that is I think it's always best to ask your doctor or your nurse if it's okay if you record them, because I think there will probably be different preferences on whether or not they want to be recorded or not. So it's always important to ask permission before you do that. There's also a glossary, which is really helpful. I feel like a lot of times I'm Googling, different terminology that I see in charts. I'm like, oh, I don't know what that means. I got to look that up. So I can only imagine being a caregiver, listening to this information, being that second set of ears and trying to take it all in and not knowing what that means, and not maybe necessarily wanting to jump in and say, what's that? Explain that. So this app is kind of nice because it has a little glossary on it so that you can look up terms as you go. And you can also link appointments and other things to it. But really, this app is great for questions and getting organized with asking those questions and organizing the responses that you may get. Emergencies are another time when organization can be key. So it seems like inevitably, as a caregiver, there's probably going to be some emergency that comes up, and being prepared and organized and ready to respond is really important. So making sure that you have important numbers with you, saved in your phone, carry them in your wallet, in your purse, somewhere where they're very accessible. You also want to have what you need with you in case an emergency arises. So one example that I know I've seen before is like, if people are worried about their blood sugar or something like that, having like snacks or something always with you in your purse, or there are all kinds of things that you can carry with you, medication, cleanup supplies, anything that you may need, have a little emergency bag or something that you can take with you. The ER is, always, if there's an emergency, you should go to the ER. And there's also the part of the ER that's James specific for James patients, which can be nice as well, where you have physicians and people who are, oncology knowledgeable to treat you if you go to the ER. And then one thing I wanted to review quickly here is on the website is listed on the slide, so if you go back and check out these slides later, you can get the website for this, or if you go to patient education on OSU's website, there is this really great resource on emergency care for patients of the James. I just kind of stumbled upon this and didn't know it existed until just a few days ago, for what to do basically in an emergency. So what to do if the doctor's office is closed. You can call, usually you will get somebody on call. There's a little blurb here about medicine refills, so knowing, before a weekend or before going on vacation, checking to make sure that you're not going to be out of medications and giving your doctor at least a week to get things refilled. But what I like is all of these different symptoms. So symptoms and when to call your doctor. So they list a symptom, what a common problem might be, and what action you should take. So for example, if you're having bleeding in your urine, you're going to want to call your doctor right away, even if you've been given different instructions. If you have blood in your vomit or stool, you should call your doctor right away. There's a little, if you're bleeding from your nose, a little blurb about first aid, and then if the bleeding doesn't stop within 10 minutes, call your doctor. So they go through fever, cold symptoms, mouth sores, nausea. I mean, there's chest pain is one where it's like immediately call 911, skip calling the doctor, skip waiting 24 hours. This is one where you want to take action quickly. So I think this is really a helpful thing, because sometimes I feel like all different things come up and you don't really know, is this an emergency? Is it not? What should I do? Who do I call? What do I do? And so it also has this little organizational tool at the end where you can write in phone numbers for your oncologist, your nurse practitioner, your family or primary doctor. This is the number for after hours. If you call after 5 p.m., this number, if there's an emergency or you have a question, the operator can page whoever is on call to address your concerns. And then some other places for other important numbers, maybe family members or friends or other providers that you would want to have. So I think this information can be helpful when you feel like you might have an emergency and you kind of don't know what to do. This could provide some guidance. And some additional ideas for getting organized and staying organized. One thing is to try to create a place for everything if you can. That seems to be the most helpful thing with organizing. Having cabinets or files or just a place where things can go so they're not just kind of exploding all over the place. Trying to avoid procrastination is important. That's hard because, I like this little fortune cookie, stop procrastinating starting tomorrow. I think that's the tendency of some folks to just wait because, you can always do it tomorrow. Why do today what you can do tomorrow? But if you're going to be organized, trying to avoid the procrastination is helpful. Eliciting the help from other organized people. So this can be really great. If you just tend to be kind of a disorganized person and that's just the way you are, it's okay to ask for help. It's okay to ask that friend that you know is super organized to help you. Chances are, if you know somebody who's super organized, they probably really like organizing, so they're probably going to be willing to help you if you need that. Setting priorities at the beginning of the day can be helpful. So just starting the day off with, okay, what is priority? What needs to happen today? What do I need to get done to help you focus and not get off task? It's often important to remind ourselves to, especially caregivers who I feel like are multitasking all the time, trying to do a million things at once, to remember to try to unitask as well. So although you may be pulled in a million directions and you may want to multitask, if you're trying to get organized, try to do one thing at a time versus 5 things at a time where you have to split all your resources and energy. When it's really something important, you want to multitask versus unitask. And then, disperse information in an organized manner if you can. So I think caregivers are often given the task of giving updates to family, friends, dispersing information on what's going on, how's treatment going, how did surgery go, how's so-and-so feeling. So if you can find a way to help you get organized, that's great. So there are things like Caring Bridge, which is kind of like an online blog or journal where you can write updates and then people can sort of follow that, or they can check in there for an update. So you're not constantly having to make a million phone calls, send a bunch of emails. You can put the information in one place and other people can be responsible for checking in there to get the information. Email chains can be helpful, phone chains, having a go-to person and saying, hey, I want to make you the person responsible for dispersing information, so you just have one person to tell, and then let them give the information, whether that's through email or through phone, or Facebook is something people seem to use a lot these days as well for giving updates. And then just making sure that you're taking care of yourself as a caregiver. There are lots of options. James Care for Life has, it's actually November is National Caregiver Month. So in November, there's a conference for caregivers. There are some other things around. The Central Ohio Area for Aging, or Central Ohio Area Agency on Aging, has caregiver support groups, and they are non-disease specific. So this could be any disease where you are a caregiver. It could be cancer, Alzheimer's, dementia, any kind of chronic disease. So I think support groups or anything where there are other caregivers present, it's always really nice to be able to say, like, what do you do? How do you get organized? Asking other caregivers what they do, because they're going to be your best resources. Asking others how they get through and how they organize. So I want to end on talking about thoughts and worries, and how to organize your thoughts and worries in a helpful way. So the thinking process and the things that go through our minds can get pretty overwhelming pretty quickly, and especially I think for caregivers who are worried about managing different roles that they may have while caring for somebody who's ill and also working and also parenting and doing all these things. Thoughts and worrying can get pretty crazy pretty quickly, and that can impact your ability to concentrate, your ability to be productive. Sleep gets disrupted pretty quickly, and it can have an impact on your mood. So we know utilizing supports is important, and also doing things like journaling or meditating. I'm going to talk specifically about an activity that you can use to help organize your thoughts and worries, and that's called the Worry Stopper. So what you would do to utilize this activity is you'd first want to start with just making a list of all the things that you're worried about, all the things that are on your mind that are your concerns, your worries, your thoughts. And they can be about anything. They don't have to necessarily be related to caregiving for somebody who has cancer. They can be work-related, family-related, just absolutely anything. So you want to start with making a list. And then you want to use this chart to figure out what box each of your worries belongs in. And that's categorized by, is this worry something that's important or not so important? And is it something that you have some control over, or is it something that is out of your control? And the important, not important, I think you need to try to remember to take a big picture approach, because most of the things we worry about, we feel like they're important. But really, I'm worried about making sure that I remember to call my friend on her birthday. In the grand scheme of things, if that doesn't happen, the world won't end. That may not be as important as I need to make sure my, loved one's prescriptions get filled. Like, that's probably a little bit more important. So remembering to differentiate important versus not important with a big picture in mind, because I think it can be easy to end up with everything being important. So it's really trying to force you to prioritize the things that are on your mind between, okay, really, in the grand scheme of things, is this worry an important one or is it not? So sometimes doing this just in and of itself is helpful for people, just to literally organize their worries, organize their thoughts. Worry can be incredibly difficult because it just goes and goes and goes and goes in your brain. And sometimes it helps just to do something about it, be active about it, do something with all that stuff that's in your head. But you can also take it a step further And these boxes, the boxes that you end up with, so I'll kind of go back and forth here. Box 1, which is right here, that is the important and in your control. So if you have a worry or a thought that is very important and you have some degree of control over it, you want to act on it. Do what you need to do, solve the problem, take a problem-solving approach, and act. So you can kind of cross it off the list and stop worrying about it. If it's box 2, so this is not important but in your control, these are the things that should become kind of back burner, save for later. So you could do something about it because you do have a degree of control, but it's not top priority. So it goes to the bottom of the list, basically. Back burner, save it for later. Number 3 is a very important box. Oops, I'll go back a second. So box 3 is those worries that are important and you don't have any control. So these are the toughest ones because it's kind of like, all right, so it's really important. I'm really worried about it and I can't do anything about it. So what are you going to do? So what you can try to do is to move it towards box 1 where you do have some control. So this includes taking a situation where you maybe don't have any control. For example, maybe you're worried about how you're gonna do at work on your next performance evaluation. You don't necessarily really have much control over that. It's important. Maybe a raise depends on it or something like that, but you don't have any control. So you either have to cope with it and manage your anxiety, distract, talk to other coworkers about how their evals have gone, find some way to either cope and accept what's happening, or find an aspect of control. So maybe you can't control the outcome of your eval, but maybe you can contact your boss and see if you can move up the review because it's just making you anxious to have to wait for it. Or you can talk to other coworkers about how their reviews went so you can get a feel for what to expect. Or talk to your boss or supervisor about, what does this process look like so that you have a little bit more information. So finding some aspect of control can be really helpful and really important. And then the last box is my favorite, and that is box 4, which is it's out of my control and it's not important. So these are the things that you just want to throw away because they don't really matter. If they're not important and it's out of your control, get rid of it. Not worth worrying about, not worth thinking about, toss it in the garbage. So I will quickly here review an example of kind of what this looks like when you really break it down. So these worries would have maybe all been in a list, and this is just an example of maybe a caregiver is worried about when the next CT scan is going to be. They left their appointment and it wasn't scheduled, and the caregiver is like, oh my gosh, what are we going to do? When is it? What do I do? It hasn't been scheduled. Nobody told me. Okay, so this is important, and there's an aspect of control. So you can call and get it scheduled. Call the nurse, call the doctor, find out when is my loved one supposed to be back for a CT scan? When is that supposed to happen? Time off work options. So I think caregivers are often like, oh my gosh, I don't know what to do. Can I do it? What about FMLA? Can I take leave? Do I have to take my vacation? What do I do about taking time off? So this one is a degree of control as well, where you can maybe talk to HR or look at your benefits and figure out what your options are. So again, that box is act or do something different. Some of the back burner options, I had a caregiver who was really worried about her daughter who wanted a new pet for Christmas, and it just was like not a good time. She's like, my husband's sick. We can't possibly have a dog right now. It's just too much. I just don't know what I'm going to do. And we kind of had to take a step back and say, okay, really, this worry in the grand scheme of things is not that important. If it's not a good time for a pet, then it goes back burner. You worry about that later, something that's not super important. Worries like I may not be able to make the family reunion, or I've gained a few pounds or something like that, where in the grand scheme of things, stepping back, these things aren't life or death, right? They aren't things that are going to end all, be catastrophes. So they can kind of fall to the back burner. You could do something about them, right? You could get a pet. You could send in your RSVP to the family reunion. You could try to start exercising or eating better to, to work against that weight gain. But really, they're kind of back burner things because they're not so important. Things like caregivers worrying. This is just an example. A caregiver worrying about what her coworkers think about her being away from work. So no control. You can't control what your coworkers think. And really, in the grand scheme of things, not important. So throw it away. Those are some examples. And then that difficult box. So what am I going to do if my loved one's treatment stops working? So really important, but really not in your control. So maybe you cope by praying about it, journaling about it, talking to other caregivers about how they've dealt with that situation, talking to maybe something you can do about it if you're gonna try, if you can't cope, but you wanna focus on how do I move it up to box one and actually do something, find an aspect of control. Maybe you talk with your medical team about if this treatment stops working, are there other options? What might that look like? Or get more information if you feel like that would be helpful for you. So this is just an example of what the worry stopper looks like and how you break things down into different boxes that essentially tell you kind of what to do. Do you need to act? Do you need to throw it away? Do you save it for later? Do you need to kind of cope with what's going on? So this can be something that's helpful with just getting your thoughts and worries organized.